everyone. My name is Katie Brumfield, and I am the Career Services Specialist at the Colorado School of Public Health. And today I am talking to Thomas Rotering. Thomas graduated from our school in 2019 with his master's in public health in health systems management and policy. So hi, Thomas, how are you?
Hi, I'm doing very well. Thank you for having me today.
Yeah, thanks for joining us. Could you tell us a little bit about your current job, your job title, where you work, and then if you wouldn't mind describing a typical day or maybe larger projects you're working on?
Of course. So currently I work for the University of California, San Francisco. I'm working remotely. I'm sure many people have dealt with that through the pandemic. So I'm living back in Colorado right now, but I spent about a year and a half out there in San Francisco. And at the University of California, San Francisco, I am sort of at the intersection of a bunch of different departments. So sometimes it's tough to know what to tell people. But I work at the Center for Tobacco Control Research and Education, which is an institution that brings in a lot of different doctors, lawyers, public health professionals to benefit the work of tobacco control. So it's very broad. And actually, they're broadening even more to include cannabis research. And that's sort of where I fit in. Having some experience working with tobacco and cannabis in Colorado meant that I was sort of a natural choice to be a researcher with UCSF. So my official title is an assistant specialist. With government jobs, you know, you've got very specific titles that's connected to your salary. It's connected to what you can and can't do. But right now, I'm basically just a kind of a self-directed researcher. So I'm connected with a drug abuse grant that the National Institutes of Drug Abuse awarded to UCSF. So my prerogative is to sort of go out and study the different ways that cannabis policy is being implemented throughout the United States. I do research projects related to legislation and different legal areas, as well as lobbying and different corporate influence activities. So really leaning on my training at CSPH and especially the HSMP degree. Should I talk a little bit about my typical day?
Yeah, if you wouldn't mind.
Great. So with academic research, there's a lot of sitting at a desk and reading a lot. So the first few months that I got there, I was just trying to get up to speed on everything, and I read probably 100 different academic journal papers, really just going through stuff. You work very closely with a mentor who recommends you books, different blog posts, different academic journals. It's really just having that curiosity to go out and learn a lot. And then once you sort of get up to speed, there's a lot of reading and writing. So currently I have a paper out to a journal that we got a revise and resubmit on. You get very acquainted with sort of the academic publishing world, which is very different from what I sort of expected to go in, but academic research has been really fun and really rewarding. Again, I pull a lot on my education at the Colorado School of Public Health, but so a typical day, I might, you know, answer some email, do some writing. I'll do some data analysis, both qualitative and quantitative. And on a good day, I might call someone to conduct a qualitative interview, go through an interview guide, sort of just have a general conversation, really to just hopefully become the expert on what I'm talking about, and then go through and go through many iterations of a research paper, and then hopefully publish that research.
Thank you. Yeah, that's very cool. Could you tell us a little bit about your career path? You know, how did you choose a degree in public health, and you know, what did you think you would do with it? And yeah, just kind of how did you end up here?
Yeah, of course. So in college, I studied biology. I was a pre-physician's assistant studies. So I imagined going more to the medical side of things. But I also loved policy, and I loved to read the news, talk about what the United States government should do, what state government should do, what entities like the United Nations should do. And so the natural choice was to go to the Colorado School of Public Health for global health systems management policy. So it's global studies on which I believe is sort of a certificate, or it's almost like a minor. And then the specific field of study was HSMP. From there, I was able to get a few internships in Colorado. With you, Katie, you were able to help connect me, and sort of through the capstone experience as well, you get a lot of practical experience. That looks really good on a resume. But actually, through my capstone program, I met my current boss, or I guess he just retired, but I was interviewing him for my capstone. Then we connected after I graduated for a position that opened up at UCSF, and was able to just transition into that. I imagined going into more sort of practical policy things, maybe working for a Department of Health at the state level or the local level. But what I really found was that I just having graduated, I had a lot of knowledge, but I didn't have a lot of practical work experience, and I really wanted to figure out what works and what doesn't work, and sort of pull on the collective experience of public health. So research has been amazing. I've really enjoyed getting to know a lot about just the world of tobacco control, and then the emerging world of marijuana and cannabis. There's a lot of crossover. There's a lot of things that are unique about cannabis. So sort of just diving headfirst into the world of academic research has been rewarding intellectually. There's so much to learn.
Yeah, it's true. How would you say the Colorado School of Public Health has prepared you for your current role?
Well, there's so many ways. So just academically, there's a lot of classes that I really enjoyed. One was my research methods class, where we really learned how to read an academic paper and analyze it and pick it apart. One thing that has certainly been confirmed for me is that no paper is perfect. You can always find holes in your own research and in other people's research. I also really enjoyed my health policy class because that sort of was one of the first classes I took. It was with Greg Tung, and then two other professors who taught with him. And that was a really interesting class. Greg Tung actually worked at the Center for Tobacco Control back in the day. So he told me about it. And I remember in one of my first classes, I was like, wow, that would be an amazing job. And here I am. But I would say those classes really prepared me to sort of have a comprehensive view of public health, and one that isn't narrowly focused on just medicine or health education, but is connected to policy, social structures. There's so many factors that go into sort of the research we do, and just writing a paper and being in public health in general. So I really like that broad perspective. And then there were also specific classes that gave me a lot of specific skills for it. But apart from that, I think it was just establishing connections with other people in public health, and really learning what it means to be a public health professional. There's a certain demeanor of just collaborative excitement about public health that I think sort of transcends like a specific expertise. Like you don't have to be a doctor to work in public health. You don't have to be an education specialist, but you can really just work with all those people. And it's really exciting. And I think the Colorado School of Public Health really introduced me to that, and it's been consistent throughout the rest of my career.
Yes, there's lots of collaboration in public health. And it sounds like you did a lot of networking as a student that really helped grow your career afterwards.
Yeah, I think so. I was a little wary of networking. It seems like sort of like being the most popular kid in school. Like I don't know what exactly networking means, but at the Colorado School of Public Health, they really just let me know and kind of helped me learn that networking is just about maintaining relationships, following up with people, messaging with them once in a while or emailing them. If you work with someone, maybe getting them to recommend you on LinkedIn, or write a little write-up, something like that. And I do think that I wouldn't think of myself as a good networker, but really just maintaining relationships is great. So
That
it's
makes a
been,
good networker.
I guess so.
Um, so what was your job search like, and how, a lot of people want to, either find a job in another state or move out of Colorado or whatever state they're in. And sometimes that can be hard to find a job in other states. What was that process like for you?
Yeah, so the School of Public Health offers a ton of resources, a lot of different job postings, opportunities to follow up with. I remember applying for a bunch of different jobs. Sort of after I graduated, I was really focused on finishing school well and wrapping up projects. I was also working and had an internship. So I was really busy, just kind of kept my head down and focused on that. In hindsight, it would have been good for me to maybe start applying in the last couple months of school. But for me, it took about 2.5 months after graduating until I found that opportunity and got a job offer. Even that short period of time, though, can be very demoralizing. And I'm sure in the pandemic, it's been tough for a lot of people, but just keep your spirits up. I think that there's a plan for each of us, and you'll find your place. So just a little bit of encouragement if someone's looking for a job right now. But like I said, I had established a connection through my capstone. And so when a job posting popped up with someone that I had interviewed, it was sort of the natural place to apply. And I could demonstrate that I was familiar with the organization I was applying to, my cover letter and resume. And that went really well. I was a little nervous moving out of state. When you graduate from an organization like the School of Public Health with a degree in global health systems management policy, you sort of think the sky is the limit. Maybe I'll be managing like a nonprofit program in like Tanzania, or I could be back at the Colorado School of Public Health working as a researcher. So there's so many different opportunities that you can apply for. And so moving out of state was a little bit tough, but getting to know the organization beforehand and sort of what I could expect, talking to current employees, other people who I would imagine I work with regularly, really gave me a sense of calm. And then, the University of California is such a big organization that they have a lot of support resources. And I never felt like I was sort of, left alone in that process. And also working with you was great. It's encouraging to work with the student career services and sort of be encouraged in that way, and then also connected to a ton of resources. And I'm sure you remember we were emailing back and forth about sort of my offer letter, what position to take. So that was actually a really positive experience for me.
Yeah, and I remember it was a tough decision because it's a big move, and it's just, yeah, sometimes that can just be kind of a scary leap, but I'm glad you did it because it's turned out to be a great position and good career growth for you.
Yeah, absolutely. And I had a couple other opportunities in Colorado. I don't think there were ever offer letters, but I had a good feeling about them, and they let me know there would be an offer forthcoming. And I think it was honestly just like that excitement of going to a new city I'd never lived in. I didn't know many people there, but I mean, it's exciting wherever you can go. And now I'm back in Colorado and, thinking about where I want to be long term. And Colorado is beautiful. It's a beautiful place to go to school and also to work. So.
Yeah. And that's nice. You can be fully remote and live wherever you want, maybe. All right. So one last question. What advice do you have for someone that might want to pursue a degree in public health and health systems management and policy, or work for university research? What type of advice would you have for someone?
Yeah, I would say that if you're interested in working on collaborative teams, public health is a great area. I work with so many interesting people, and I'm able to call people. Academic research especially enables you to just talk about an issue and get to know people, get to know the issue really, really well. And so it's very in the weeds a lot of the time. So it's very focused on a very specific issue, and then it can also be very broad and collaborative. I would recommend that if you're considering going into public health, or maybe just as you consider any career, knowing yourself really well is important, knowing what you like and don't like. And you can explore that through your career. You don't have to know exactly what you want to do when you hop in, but as you learn more about yourself, what kind of team you want to work in, and then how you can best, what really inspires you. So how you can best live out your passion for whether it's maternal and child health or whether it's policy, that will fuel you and sustain you in whatever job you do. So as long as you hold on to what you're passionate about, it's a lot harder to burn out. It gives you energy to keep going and to be creative. And so I would just recommend know yourself and take that leap of faith. And if you need to reimagine your vision or go back and sort of see how you can change your career or your position to better benefit yourself, then you can do that. I would also say during the pandemic, working remotely, hopefully we're on the tail end of that, but it's a great idea to just always have your Zoom camera on, especially if you're a student or if you're looking for a job. There's so many people at conferences or in meetings who just keep their camera off and they stay muted, only jump in if they're spoken to or asked to hop in. Really get yourself out there. It's so hard to connect digitally anyways that people should be familiar with your face, and they should be familiar with you. Never miss a chance to advocate for your issue, and then people will see your passion for that and they'll remember you.
Great advice. Well, thank you so much, Thomas, for sharing your career and career path with us. And
Of
thank you
course,
for
thank
the
you,
great
Katie.
public health work you're doing.
Oh, thank you very much. I appreciate it.
All right, thank you.